Hello, so I'm going to start dermatology, okay, to make it easy for you. Okay, so this is a picture of eczema. Okay, so they are asking what type of eczema is this. You can see here. So it's allergic contact dermatitis, acute allergic reaction, intensely itchy, edema and vesicles, and more chronic lesions are often likely find. Okay, so see here. So it's allergic contact dermatitis. Okay, now what type of eczema is this? So it's contact irritant dermatitis. See here. Okay. So irritant dermatitis, itchy or sore, and presents as slight scaling, edema, and fissuring. Okay. So it's common in dishwashers. Okay. So now what type of eczema is this? So it's a nickel allergy. She had due to ring and due to the belt. So nickel allergy, one of the most common causes of allergic dermatitis in affected individuals. Dermatitis, also called eczema, develops in places where nickel containing metal is touching their skin. Okay, so it's contact dermatitis and allergic dermatitis, and this is contact irritant dermatitis, allergic contact dermatitis. Okay, common in barbers who visits barbers. Okay, so what type of eczema is this? This is also contact allergic dermatitis. This is due to henna, due to rubber material. Maybe she is allergic to. Okay, so acute allergic reaction, intensely itchy, edema, and vesicle, and more chronic lesions are often lignified. Okay, so what type of eczema is this? So this is nummular. Okay, you can say this quite like coin shaped. So this discoid eczema is a type of eczema dermatitis defined by scattered, well-defined coin-shaped and coin-sized plugs of eczema. Discoid eczema is also called nummular dermatitis. Okay, so this is nummular dermatitis. Now, what type of eczema is this? So this is hyperkeratotic eczema. Hyperkeratotic eczema. You can see hyperkeratosis. Okay, so this is hyperkeratotic eczema. Okay, hyperkeratotic palmar dermatitis is a form of eczema in which there is thick scaling on the palms. Okay, so let's revise. What is this? This is allergic contact dermatitis. Okay, and this is contact irritant dermatitis. And Nichols allergy. Okay, this is nickel allergy. Contact allergic dermatitis. Nummular or discoid eczema. And hyperkeratotic eczema. Okay, now what type of eczema is this? On flexures, extensors, cheeks. So this is atopic dermatitis. Okay, so acute atopic dermatitis is red, erythematous, weeping, crusted, exudative, and may have blisters, vesicles apply. Over time, the dermatitis becomes chronic and the skin becomes less red, but thickened, lignified, and scaly, and cracking of the skin. Fissures can occur. Okay, like you can see here, fissures. Okay, so in chronic. Fissures in chronic. Okay, in acute there will be weeping or crusted exudative vesicles apply. Okay, so what type of lesion is this? See here. So this is seborrheic dermatitis. You can see seborrheic dermatitis. Okay, so infantile seborrheic dermatitis, also called cradle cap or napkin dermatitis. It clears by about 12 months. Okay, of age, and characteristically the skull is yellowish and greasy or white and brown like, and itchy tends to be absent or mild. Okay, itching tends to be absent or mild. Okay, so this is seborrheic dermatitis. Above both pictures are of infantile seborrheic dermatitis and called cradle cap or napkin dermatitis. Okay, and itching is rarely seen. Okay, itching tends to be absent or mild. Okay, so what type of lesion is this? This is urticaria. Okay, urticaria, transient pruritic swelling of the skin, results from edema in superficial layer of skin, also called wheals, hives, and nettle rash. Well demarcated erythematous lesions, always transient. This is always transient. Okay, so what type of lesion is this? Petrasis alba. Petrasis is scaly and alba is white. Okay, so characterized by the presence of ill-defined scaly faintly erythematous patches, and these lesions eventually subside, leaving hypopigmented areas, then slowly returns to normal pigmentation. Okay, so it resolves by the arm. Now what type of eczema is this? So it is astotic eczema. Okay, astotic eczema is common type of dermatitis that occurs as a result of dry skin. Astotic eczema often has a distinctive and crazy paving appearance. Diamond-shaped fillets of skin are separated from each other by red bands forming a network, and there may also be scratch marks. Okay, Now, what type of lesion is this? So this is lichen simplex chronicus. Lichen simplex chronicus. Okay, and lichen simplex chronicus is a chronic itchy skin disorder characterized by well demarcated erythematous patches and plaques of thickened leathery skin. Thickened leathery skin. Okay, so lichen simplex chronicus. What type of lesion is this? So pomfolix. Okay. So pomfolix is itching vesicles on finger, palms, and soles. Itching vesicles on finger, palms, and soles. Pomfolix. Okay. Blister small form and intensely itchy. Okay. So what type of lesion is this? This is plantar psoriasis. Plantar psoriasis. Psoriasis is a chronic inflammatory skin disease in which there are clearly defined red scaly plaques with silvery scales. Okay. So this is plantar psoriasis. What type of lesion is this? And this is palmar psoriasis. Plantar psoriasis and palmar psoriasis, scaly lesions. Chronic inflammatory skin disease in which there are clearly defined red scaly plaques with silvery scales. You can see here. Okay, so what type of lesion is this? Was filled. See, so palmoplantar pustulosis. Palmoplantar pustulosis. Palmoplantar pustulosis presents in the crops of sterile pustules occurring on one or both hands and feet, also called pustular psoriasis. Okay. Okay, so this is pomfolix. These are not, pus filled. You can see here. Okay, so pomfolix, and this is palmoplantar pustulosis. You can see pus filled. Okay, so what type of lesion is this? Again, psoriasis. Okay, so psoriasis is a chronic inflammatory. Same explanation is here. Okay, so again, what type of lesion is this? So lichen planus, very itchy, pruritic, polygonal, purple papules, PPP, 2 to 5 mm diameter, flat-topped planar, melancholis to form plugs, and oral lichen planus. Oral lichen planus may appear as a white lacy patches. White fine lace-like striae called Beckham's striae are present in lichen planus, which are absent in above mentioned conditions. Okay, so what type of lesion is this? So this is guttate psoriasis. Guttate, can see guttate like. So guttate psoriasis. And numerous small plaques less than 1 centimeter, pink, scaly, thin patches are plaques of psoriasis. Scale can be subtle in early lesions and widespread lesions predominantly over the trunk and limbs. So guttate psoriasis. What type of lesion is this? Again, lichen simplex chronicus. Lichen simplex chronicus. And we are here as well, lichen simplex chronicus. Okay, and lichen simplex chronicus. Leathery skin. Okay, what type of lesion is this? Alopecia areata. Okay, so alopecia areata, focal hair loss, well demarcated single or several round oval patches of normal appearing skin. Characteristic is exclamation point hairs may be observed, particularly at the periphery of bald patches. Okay, so now what type of lesion is this? Again, discoid lupus. Discoid lupus erythematosus is a chronic scarring skin condition. It is the most common form of cutaneous lupus. Discoid lupus. Which type of lesion is this? You can see here. So this is stasis eczema. Stasis eczema. So varicose eczema, also known as venous gravitational or stasis eczema, is a long-term skin condition that affects the lower legs. It is common in people with varicose veins. Okay, so stasis eczema. So these signs are present in which dermatological conditions? Auspit sign. Okay, in psoriasis. Okay, so if the surface of psoriatic plug is scraped with a blunt scalpel fall off a layer of white lamellae, they exhibit coherence after removal, much like candle wax. The Auspit sign refers to the appearance of small bleeding points after successive layer of scalp have been removed from the surface of psoriatic plugs or papules. Okay, you can see here. So this is Auspit sign. Removing the scalp, bleeding occurs. What is this phenomena is called? So Nober phenomena. Nober. The Nober phenomena is the appearance of skin lesion on lines of stroma. Okay, so which type of lesion is this? Honey colored. So impetigo. What type of condition lesion is this? So herpes labialis. Herpes labialis. Recurrent type is herpes simplex virus 1. Okay, which type of lesion is this? folliculitis. Single follicle is filled with pus. Okay, so folliculitis. So superficial infection of the hair follicles usually caused by Staph aureus, present as pustules in hair-bearing areas, legs and beard area. Okay, so which type of lesion is this? You can see scarring as well. So hidradenitis suppurativa. Okay, so disorder of the terminal follicular epithelium in the apocrine gland, bearing skin characterized clinically by open double-headed comedones, painful firm papules and nodules, pustules, fluctuant and pseudocysts and abscesses, and draining sinuses linking inflammatory lesions, hypertrophic and atrophic scars. Okay, what type of lesion is this? You can see here. So this is a furuncle. Okay, boil, also called a furuncle, is a deep form of bacterial folliculitis infection of a hair follicle. Okay, deep form of bacterial folliculitis. Okay, this is superficial, and you can see here it's deep. Okay, so furuncle. Which type of lesion is this? You can see it's following the dermatome, so it is herpes zoster. Herpes zoster is character of dermatomal distribution, that is the blisters are confined to the cutaneous distribution of one or two adjacent sensory nerves. This is usually unilateral with a sharp cut off at anterior and posterior midlines. Now, which type of lesion is this? This is chickenpox. You can see here. And this is chickenpox. So chickenpox is caused by herpes zoster virus, which causes multiple blisters filled with clear fluid. These blisters have a characteristic dewdrop on a rose petal appearance. You can see here, dewdrop on the rose petal appearance. Okay, and which type of lesion is this? This is carbuncle. You can see more than two faces. Okay, if hair follicle is involved, then folliculitis, and if that is deep, then will be called furuncle. But if there are more than two heads, then it is called carbuncle. You can see here. So this is carbuncle. If there are multiple heads in a boil, the lesion is called a carbuncle. Okay, and if one head, then furuncle.